psoriasis in a case of
Psoriasis,
ocular
yes,
manifestation?
because we use steroids
as
there.
compared with the patient with no ocular manifestation.
So these patients, then we can tell the dermatologist that steroid dosing then has to be monitored, plus the patients who are on methotrexate. If they develop symptoms, then an alternative treatment has to be sorted out for these patients.
Okay, from optal side, there is no change in the management. That's what you meant to say?
Yes, sir.
Okay, thank you, doctor.
Thank you, sir.
Yes, sir.
Good morning all. Reduce the recurrence by using heme coagulase and tucking in for pterygium surgery. All of us are doing pterygium surgery, and lot of time whatever method we are going for, whether it is a graft, whether it is a Bayer sclera or using fibrin glue, most of the time there is a recurrence. No financial disclosure. To compare the recurrence rate after a simple sutureless, glueless pterygium surgery with the use of topical heme coagulase and tucking in for the conjunctival autograft surgery. It was done in Riva. Study design was prospective interventional. 64 patients underwent primary pterygium surgery of any gender and age and were subjected to surgery. Were divided into two groups. A, in which a simple sutureless, glueless and conjunctival autograft was done, and group B, 32 eyes, we used a topical heme coagulase and tucking in for the conjunctival autograft. All the patients with the true primary pterygium were included, and excluded those who had a corneal morbidity, patients those who were on anticoagulant therapy, patients suffering from coagulation factor deficiencies, any history of previous ocular surgery or any ocular disease or history of any previous ocular trauma. In both the cases, it was the male preponderance of the pterygium, and most of them were the farmers doing outdoor activities. Amongst the age, maximum number of pterygium patients were from 36 to 50 years of the age group, and the surgical success rate was recurrence of pterygium after first year of the post-operative period was more in group A compared to the group B. It was 12.5% in group A and it was 6.5% in group B. In our study, the mean age in group 1 was 51.74 and group B it was 45.74, range from 18 to 80 years. The male predominance in both the group, farmers were more. In the study done by Pandey et al., the males were predominant, having 75.1% males and female 24. Rupali Venukumar had studied the 20 eyes, and their study revealed the mean age of the patient 52.4 years. The results were analyzed. Group A, 4 recurrence and 1 patient lost the graft, 3.12%, and group B had only 2 cases showed the recurrence, in which we used a topical heme coagulase. So this is a very simple technique for the pterygium surgery which may prevent the potential adverse reactions encountered with the use of any foreign material. Hence the coagulase, which is autologous, in situ blood coagulum with the use of topical heme coagulase and tucking in for the conjunctival autograft is a better option to reduce the recurrence. Thank you.
Sir, can you please explain the surgery?